Hello, and welcome to the Be Well Now Method podcast, and welcome Dr. Jan again to another episode. I'm so happy to have you here for this.
I'm so glad to be here.
Thank you. This is
Yeah.
I so just a full disclosure, I texted Dr. Jan like yesterday, 2 days ago, and said, "Hey, can we do a quick podcast? Because I am noticing that emotions kind of are ramping up as the month goes on. And as you know, I'm doing kind of a special December focus on celebrating December well, in the well state, not the stress state. But there's all these strong emotions this time of year. And this can be a time we can be well now, even with strong emotions. And I thought, oh, we need Dr. Jan for this to unpack this a little bit. So that's why I texted you and asked you to do this.
Yeah.
And so I'd like to kind of use our Be Well Now method to unpack this a little bit.
Yeah.
How's that sound?
Yeah. I'd love to.
Great. So let's start with Dr. Jan and I were doing some deep breaths before we actually hit record. So we're going to continue that now. Just like a close your eyes, get in your body, feel your breath. Let your body get comfortable. So as you put your attention in your body, just let it find that way that it can be held. And take a moment to savor that moment where you can just tend to what your body needs right now, whether that's just stillness and feeling your breath or a little bit of movement. Take a few seconds to tend to your body. Notice what it needs. And if you're moving, as you come back to stillness, notice your breath and notice that your body already knows your breath is coming in and out, and you can trust what's here now as your guide. So as we open our eyes and come back to the room,
Hmm.
I'd love to check in and notice how you're doing right now with all of this kind of holiday stuff, or whenever people are listening to this, there's always some reason to be stressed. So I'm curious, how you're doing
Yes.
right now, Dr. Jan.
Yes. You were asking me before we started recording about do I have any tips to share? And
Mm,
I do think I have a couple of things that I'm going to put it in the topic
mm,
of parent adult child estrangement,
mm.
which is something that about a third of my practice is focused on. It's a
Wow.
big part of my
Yeah.
practice. Um, but the things that are happening with that kind of, dynamic, it could, the tips that I want to share could apply to almost any difficulty that you might be dealing with
Okay.
at this time of year or about any time.
Okay.
But but certainly estrangement is top of mind for me this year because it's such a big part of my practice and who I'm working with. And
Okay.
the holidays just seem to
Yeah.
ramp it up
Mm.
like no other time of year
Yeah.
for most people.
Yeah.
Yeah,
Yeah. I'm so glad that you specialize in this, that this is an area of focus, because I would imagine it's a hard one. And so some people might not, um, want to dive into it a little bit deeper. It's complicated. And so I think
yeah,
you're right as an umbrella term talking about estrangement, but also all the emotions that come from that are emotions that we could feel in isolated ways, like grief or anger or frustration or isolation.
yeah. And actually, the first thing I'd like to share, it blends perfectly with what you do with the Be Well Now method. And it's, a lot of it is just based on things I brought in, knowing things I've learned from you, you
Mm.
know. So this is how I would describe it. I just shot a video that's going to be going out to people that are subscribed to my newsletter, but it is a pretty simple approach for dealing with estrangement, at least as I conceptualize it. And I think it would resonate with many different things, like I just mentioned. But the way I like to describe it is there's really two things. Number one, how to get more resilient, and in particular, emotionally resilient. So that's a feeling thing. That's an in your body sensation and feeling center thing. But the other thing is get more strategic. That's more of a thinking thing.
Okay.
And the
That's
two,
interesting.
when you put those two together, it's almost magic the way
Yeah.
they reinforce and complement each other. Because sometimes if you can think about something differently, it helps you calm down.
Okay.
Sometimes just the physical comforting of yourself or
Mm,
grounding yourself
yeah.
emotionally, like get a grip,
Mhm.
is what allows,
Literally. Yeah.
yes, what is what allows you to think better. So you kind of see why
Okay.
I'm so enchanted with this way of
Yes.
thinking. I'm learning to describe it to my
Yeah.
clients.
I love simplicity. It's so helpful in these moments because our brain is hijacked and we don't need something complicated, right? We need something really simple. So if I could remember, okay, Dr. Jan said two things, you know, that's all I have
Yeah.
to remember, just these two things. So can we unpack those then?
Yes.
Wherever you want to start, brain or body, the
Yes.
strategic or the resilience, tell me more about those.
I'm going to start with the body part, but I want to preface it though with it's really start either place. It
Mm,
doesn't matter. It's
okay.
like whatever's most accessible to you,
Yeah.
start there,
Okay.
you know.
Yeah.
But especially because of your specialty with the body centered kind of work,
Yeah.
exercise physiology,
Yeah.
you know, that where I would like to start is well, this is how I would describe it that when we're in pain or
Mm,
distress
yeah.
of any kind, it's like, how do we ground ourselves?
Mm,
How do we comfort ourselves?
yeah.
And those things are just not, they're not taught. They're not accessible. Usually, when you even start being exposed to them and playing with them yourself, experimenting, they feel embarrassing, uh, uncomfortable, you know. So, but I'm going to go there anyway and just describe it. This is how I would put it. If I was going to do that for myself, um, I've certainly, from years of being a professional yoga teacher and meditation teacher, I certainly know a lot of these things. But because of working with you, it's taken on such a different form of how to emotionally ground using movement. So
Yeah.
So here's
Give
just
me an
a quick
example. Yeah.
example
Yeah.
is let's say if I become aware that I'm in distress,
Mm-hmm.
then I've certainly for years known about restorative yoga
Mm,
or yoga therapy or any of
yeah.
those types of things. But what I notice when I'm doing any kind of movement now
Mm,
is that, especially if I'm in that state where I'm in distress, I need grounding, I need comfort. You know, what would help someone that's dealing with that? I'm just so aware that the kind of movement that I'm doing is it's not designed to make the pose look a certain way. It's not designed to align a certain way. It's designed to listen to my body and offer it comfort. And I'll
what a
get
shift.
yes,
Yeah.
and it's like here's a great example
Yeah.
of when we do twist, I
Mm-hmm.
can just realize there's this shift from almost manhandling myself into a twist. Let's
Yeah.
say that's
Yes.
supposed to be releasing tension, but I
Right.
thought of you the other day when I was experimenting with this because it's
Yeah.
like I've learned from you that this should feel good.
Yeah. Right
This
now.
should feel
Yeah.
good when you're doing it.
Yeah.
And it's not about trying to wrench yourself around as far as you
Mm-hmm.
can go.
Yeah.
That's your inner pusher talking,
Mm-hmm.
you know, but it's more of how do you come to that stopping place and you just stop there.
Mm.
And if let's say if you're doing a twist lying on your back,
Yeah.
it's like, okay, I've been taught you stretch both arms out straight in
Yeah.
a T position. And
Right.
it's like, no, what I'd really like to do, maybe one arm is outstretched, but the other arm is on my rib cage.
Mm.
And there's a comforting
Yeah.
feeling, or let's just say lying on your back in any position, instead of trying to do chest openers or, heart openers,
Yeah.
it's like, no, what would really feel good right now is both hands right
Mm.
on the solar plexus, or
Yeah.
maybe one hand on the
Yeah.
belly, one hand on the
Yeah.
solar plexus. But if you think about it, a lot of that, at least my understanding of the physiology, is right in your solar plexus. There is
Yeah.
such a bundle of nerves that are
Yes.
connected to our emotions. And
Yeah.
it's like what a comfort to just
Mm.
be able to rest or even a little bit of light pressure there.
Yeah.
So let me just pause there and say, so that's what I'm thinking about
Yeah.
when I'm saying, what can you do to comfort yourself uh, on a physical level
Hmm.
that translates into emotional comfort?
Yeah. I love this. And because I work with people who are carrying a lot of extra weight, when even they hear the word yoga or exercise, it's like, oh, I can't do that. I can't do yoga. I can't get on the floor doing a twist on the floor. I can't do
Yes.
that. And so I want to comfort those listeners who might be listening to this saying, great, yoga's great for her, but I can't do it. That movement is a skill just like any other skill. And if you were talking about playing Mozart and I don't even know how to touch a key on the piano,
Yes.
that would be completely overwhelming for me. But it's a skill that you have learned over the years and developed so that you can tune in, and then adding that skill of listening to your body and trusting. You've honed in that skill, but it doesn't mean that putting your hands on your heart and doing a little rotation sitting just very gently wouldn't be just as beneficial. What I love is that you have taken the kind of yoga therapy way that we talk about things like this, and same thing with exercise, right? This is good for your brain. We have all these kind of, this is to stretch that muscle, this is to do this. And when we talk about those benefits of doing something, then we're in the future. Then it's like, okay, I'm going to do this and I'm going to get an
Yeah.
open
Yeah.
heart, and I've got to
Good point.
really, if I do it harder, I'm going to get open heart. So I think there's this kind of double edge of talking about the benefits of doing a type of exercise or movement
Hmm.
versus let's move into it and then see what happens and then let your body decide what would feel good right now. And I like how you use that example of self-talk. Well, oh, well, that would feel really good right now. And
Hmm.
no yoga therapist, no exercise physiologist, no health coach, nobody can say, hey, put your hand on your rib cage. That would feel really good right now. you know, only you know
Yeah,
that. And
exactly.
this
I
is,
love it.
yeah. And this
Yeah.
is what it means to be well now. Well is trusting what's here now as your guide, and only you can feel that. And
Yes.
that's well. So that's why I believe that anybody could be well now, right now, because we can shift that focus. So I love what you're describing is this kind of repertoire that you can build, this toolbox. But
Yes.
anybody listening to this can do this right now by just pausing. Okay, what would feel comforting in my body right now? Maybe it's
Yes.
soft music. Maybe it's holding your own hand. Maybe it's something that somebody used to do for you. Like my dad used to hold my hand. So oftentimes I'll hold my own hand,
Yeah.
and it'll be instantly comforting for me. And only
Yes.
for me. It might not do the same for somebody else. But that's the
Yes.
idea, is trusting that inner sense of comfort. I
Yes.
also like how you said, and I'd like you to talk more about this, that there can be kind of this, Kristen Neff talks about the backlash, right? That when we think about taking care of ourselves, there's this instant stress response too.
Yes. Yeah. And actually, I do want to be really explicit about something too, because I literally thought of you in doing some of this,
Yeah.
especially when I was working on a seated twist.
Hmm.
And it's like, okay, when you're manhandling yourself
Yeah.
into this, it's like, Jan, do you know what you're in a stress state.
Yeah.
You are
Yeah.
trying to move in a stress state.
Yeah.
That I've learned that from you. And it's
Yeah.
like, no, when you're doing this, you want it to be in the well state
Yeah.
because number one, you won't be sabotaging it.
Mm-hmm.
You may be taking away benefits, like let's say
Yeah.
a chest opener, you
Yeah.
actually lost the chest opener by pushing,
Yeah.
you know,
Yeah.
into it. But when you do it, you start to differentiate
Mm.
between am I in the well state doing
Mm-hmm.
this or am I actually in a stress state doing
Yeah.
this?
And that
You
simple
know?
question is, am I trusting or am I trying? Am I trying to open my chest, or am I trusting what would feel open? What would
Yes.
feel comforting? Yeah. And that's the simple shift. Yeah. Yeah. So
Yeah.
it's
And I like
complex,
what you're
but
saying
yeah, go ahead.
about, maybe we're benefitizing these things too
Yeah.
much.
Yeah.
And instead, it's more getting into the position and letting your body tell
Hmm.
you
Yeah.
what you need or what would feel good
Yeah.
versus, oh, do this and it will create this effect.
Yeah.
Like
Yeah.
you said, you're looking for a goal or a result versus being in the moment.
Yeah.
So maybe we could say that certainly one of the ways to tell, am I in a well state, is am I in the present moment?
Hmm. Right. Right. Yeah. All right. So that's the embodiment piece. That, what did you call it? That resilience, grounding.
Yeah, if you're looking for ways, I guess the way I'm thinking about it is how do I get more emotionally resilient?
Yeah. Okay. So that builds
Uh,
that emotional resilience because you're in your body, you're in the present moment, and you're um, kind of almost like calling upon your resources. Like Amy Cuddy talks about presence being having access to your strengths and your values, and that's
yeah,
presence,
yeah,
not just being in the present moment, but presence is showing up with everything you have. That's resilience.
yes. And I'll
Yeah.
circle back to Kristen Neff
Mm,
that you mentioned and self-compassion
yeah.
as her, pioneering work has highlighted. That I would also say, one of the key words is comfort.
Hmm.
So if you're if trying is even isn't the word I want to use, if you're looking to offer yourself some compassion, some
Mm,
self-compassion, well, a lot of it is when we're in emotional distress, we
yeah.
need comfort.
Yeah.
So that's where
Yeah.
the Kristen Neff parts, it's like I'm offering myself comfort
Mm,
on a physical level,
yeah.
which
Yeah.
translates to an emotional comforting. And
Right.
we need that.
Yeah.
And we
And
can offer it to ourselves.
yeah. And for those people who have hard time offering it to themselves, I like to think of it as if, if someone, when I came to your office there and was able to visit you in your office, you were like, oh, what would you like? Would you like a glass of water? Would you like, and it was very comfortable. And if I came in distressed, you would have comforted me.
Yes,
And you do that for your clients, and we do that for friends all the time. If they show up distressed and they're like, oh, I'm having a hard time, we offer comfort. It's automatic and we know how to
yes,
do it. So being able to do that for ourselves, that builds trust with a friendship, right? If I came in your house and I was upset and you were like, well, whatever,
yeah,
and talk about yourself, and I was clearly upset about something, that wouldn't build trust. But how we build
yeah,
trust in ourselves, right? And that resilience comes from that trust. So, yeah, so I like this kind of how can I comfort myself, and how do I offer comfort to somebody else? What would feel good right now? What do you need right
yes,
now? That same kind of tone with ourselves.
yes. And again, if it's difficult to get into movement, I
Mm-hmm.
literally think of a time that you remind me of. Ordinarily, I'm fairly businesslike. People
Yeah.
show up, we
Mm-hmm.
sit down, I'm friendly, and happy to see them, but we get right to work,
Mm-hmm.
you know?
Yeah. Yeah.
So it's not like I'm offering,
Right.
but I remember this one time this person showed up so uptight,
Mm.
and I said, can I make you a cup of tea?
Mm.
And oh, no, 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 no. And I said, yeah, let me make you a cup of tea.
Mm.
And we literally went into the kitchen and brewed the
Wow.
tea, and
Wow.
she sat down and she had it. And you could just see it, and you could see it. It was like, gosh, I'm glad you did this.
Oh,
Yeah. So really what I was doing for her, I just kind of sensed it. I'm pretty
mm,
intuitive. And
yeah.
that's part of this thing too, is you
Hmm.
get more intuitive. When you
Yeah.
get more connected to your own body,
Yeah.
you get more intuitive to yourself and to other people, more
Yeah.
sensitive.
Yeah.
So I just picked up on that and ran with it.
Mm,
But we can do that for ourselves.
yeah.
On one of the
Yeah.
apps I use, there's a little thing that's called a coffee and tea meditation. You just make yourself a little cup of tea or coffee, and
Oh,
it's a little 5-minute
yeah.
meditation, but you're just holding it.
Hmm.
It's like that's what we're talking about is
I love
offering
that.
those things to ourselves. And I know you wanted me to say something more about the resistance to doing
Hmm.
that, and we may have already covered that.
Yeah.
But
I kind of feel like, yeah. I kind
it
of feel
it
like we did.
but I do think,
Yeah.
okay, let's just put it this way, that at least to put it out there, and this would be a Kristen Neff thing,
Yeah.
to acknowledge your common humanity. That
Mm.
when you start doing these little things, like just, I don't know,
Yeah.
doing
Yeah.
something
Yeah.
physical
Yeah.
that
Yeah.
people don't ordinarily do out in society,
Right.
you know, in the
Right.
world, that
But maybe should.
that just know that if you feel a little embarrassed or a little vulnerable, of course you do.
Hmm.
We all do.
Yeah.
And yes, it's like there's things that you shouldn't be doing those things in public. People are going to think you're weird. Don't do them. But here's the good thing. I was thinking earlier about what we were talking about with doing this lying twist.
Yeah.
It's like, well, most of what I'm doing, it's all in privacy.
Hmm.
See, I wouldn't feel free to do that in a class,
Yeah.
or it would
Yeah.
take a really special class and teacher,
Right. Yes.
but a typical yoga class, I
Yeah.
wouldn't feel comfortable doing that. I would need to be doing what the teacher said, and don't do
Mm.
anything that looks weird because she'll come over and correct you.
Right. Right. Yeah. And you don't want that. And so this is Kristen Neff talks about that fierce self-compassion that we've talked about before. And I think of like fierce kindness takes so much inner strength to say, no, I'm going to be kind right now. I'm going to choose to be kind. Even though I'm
Yes,
feeling all these emotions, I'm going to choose to be kind to myself. Inside, I'm going to choose then, kindness. And I think that that is a strength that you're building through this resilience, like you're talking about. It's a
yeah,
practice, it's a
yeah.
skill.
And I can
Yeah.
add in one more part of this that I think might be worthwhile as far as the resistance to doing this
Yeah.
is that, what I find is if we're trying to soothe someone,
Yeah.
um, generally it's not so much like just stroking them
Mm.
or I don't know. Actually, I'm going to have to talk my way through this, so stay
Okay.
with me. But it seems like what helps the most, and we don't resist so much, it's a firm touch, like a
Mm.
massage therapist would
Yeah.
do.
Okay.
They're not like lightly stroking.
Right.
There's a groundedness that's coming
Yeah.
from it's kind of like a certainty, a confidence in their touch,
Yeah.
and they're not just lightly stroking.
Yeah.
It's like so. A lot of times, I think this touch, like I'm saying on the solar plexus in
Hmm.
particular, it's not just lightly resting your hands there,
Yeah.
it's like no, there's a bit of pressure, a
Yeah.
very. I think, in fact, the word that comes to me, it's like it constantly is gentle. There's a gentle press there,
Yeah. I
or
love
there's a
that.
gentle pause here in the twist while you're waiting to see,
Yeah.
okay, what sensations are coming up,
Yeah.
so
I
you know
love
what to do
that.
next.
It explains so much why I'm finding strength exercises to be so grounding and calming. Whereas before, like years ago, I used to hate strength training, but now there's something about that very strong, very intentional,
Yes.
like engaging all those muscle fibers that almost it's like really grounding because I think it calls upon so much attention. You have to be so, it like makes me feel very grounded in my body. One of
Yeah.
my clients started calling it empowerment movement rather than strength
Oh,
training,
oh my
right?
goodness.
I know.
Oh
I'm
my
like totally, I'm
gosh.
sorry, I'm totally going to work with that. But that's like, this is not strength training. This is not getting stronger later. This is empowerment movements. Like I'm powerful right now.
Yes.
And wow, you pull out one of
Yes.
those, holy
Yes.
cow, yeah. So but again, it's a skill, it's a resource, it's a toolbox that you're building on your own. And
Yeah.
so yeah.
There's a fierceness, again, a
Yeah.
fierce self-compassion. I'm
Yeah.
thinking as you said that to when I'm working with weights,
Yeah.
machines is what I like. And it did occur to me, it's like, well, this is resistance training, or that's what
Hmm.
it's called. You're resisting. And it's
Yeah.
like, well, that's kind of a bad word
Yeah, I
in,
don't like it.
mindfulness world. We're not supposed to be resisting,
You're not
but as
training it.
usual, I always find a way to
Yeah.
bring in what you think you shouldn't have and how you actually need some of that and stop
Yeah.
judging
Yeah.
resistance as a bad thing because
Right.
it's like, but there's something
Hmm.
about pushing against
Mm.
that. And if you're doing it with relaxation and enjoyment, it is
Yes.
it feels
Yeah.
strong and
Yes.
empowering. It's not like, "Ugh,"
Yeah.
and in the stress state. You're like, no,
Right.
you know what?
Right.
You can work out
Yeah.
with strength machines
Yes.
in the well state.
Yes, you can. You absolutely can. I think of it as not thinking about the resistance. People always think, oh, I'm lifting 20 pounds, 30 pounds. Think about the strength, not the resistance.
Yes,
So, we often think, okay, I'm lifting this much weight. No, you are strong. Think about the strength, not what you're moving. So, internal rather than external. And that's what makes it a mindfulness approach. And that's what really keeps us in the well state. Yeah, there's so
yes,
much we could play with there. That's another topic. But let's move to the strategic piece because I'm so curious about that. That is that what you called it? The
yes.
strategic piece, right? The mental
Well,
piece.
you used the perfect word,
We're so in sync.
curiosity. Yeah,
Hmm. Yeah.
but literally, this is something that just came to me recently. But with any distressing emotions we're feeling, but let's put it in the container of estrangement,
Yeah.
family
Okay.
estrangement, a parent adult child estrangement
Hmm.
is so much a thing
Yeah.
right now that one of the things that makes it so hard about it is the uncertainty.
Mm.
It's like, why is this happening? And
Yeah.
it's like, how could this happen? And I tried to apologize and it didn't work.
Yeah.
And, they've cut me off. Will I ever see them again?
Yeah.
Will I ever get to see my grandchildren
Yeah.
again?
Yeah.
Or it's like just
Oof.
the degree of uncertainty.
Hmm.
So if you think about it, or just things being bad,
Yeah.
just things being conflictual, you know,
Yes.
but there's this part of being cut off, which is
Mm.
basically a form of shunning.
Mm. Yeah.
That's
Yeah.
tough.
That's deep.
Talk
Like
about,
that's core
yeah,
emotion there. Yeah.
yes. And it's
Yeah.
coming from someone that you gave birth to,
Yeah.
perhaps.
Right.
You weren't
Yeah.
expecting that,
Huge.
but just the
Yeah.
degree of uncertainty and the the strategic piece is, what I've learned about curiosity from Dr. Judd Brewer is there's
Mm.
two forms of curiosity.
Mm.
There's deprivation curiosity,
Okay.
which generally feels bad.
Okay.
It's kind of like an itch that you want to scratch.
Oh,
You need an
interesting.
answer.
Yeah. Okay.
Which, you just think of something, it's not right on the tip of your tongue or you
Right.
can't quite think of it. And now,
Right.
what was that?
Yeah.
That's deprivation curiosity or needing to
Okay.
know the answer. When is this going to be over?
Mm.
When am I
Okay.
going to hear from my child again, if
Okay.
ever?
Yeah.
I
Yeah.
need to know.
Yeah.
It's bothering me,
Yeah.
that kind of thing. It's suffering.
Mm-hmm. Yeah.
Okay, so
Right.
there's that kind of curiosity. And then there's what we call interest
Mm.
curiosity,
Yeah.
which generally feels good. And it's not like deprivation curiosity is bad and should judge yourself for doing it, because it serves a purpose or we
Mm-hmm.
wouldn't have it,
Yeah.
you know. But the shift, if you're dealing with estrangement, can be, let's say over here, your self talk, it might be what I was just describing. It's
Yeah.
like, this is awful. Will
Yeah.
this ever end? Another
Mm.
Christmas like
Mm.
this or whatever, you know? And it's like wanting to know.
Yeah.
That's painful.
Yeah.
Okay, well, one of the ways you can flip that is to not resist it because literally, if you go into that a little deeper,
Mm-hmm.
what you realize is I'm resisting it. I hate this feeling.
Yeah.
I want it to go away.
Yeah.
How do I stop this? Or
Right.
like, intrusive thoughts. You can't stop thinking about
Yeah.
your adult child or your grandchild that you
Mm-hmm.
can't see or
Yeah.
whatever. And it's just constantly
Yeah.
there. And it's like resisting it. I don't want to think about that. Think of something positive. Think of
Mm.
something else.
Yeah.
It's like, no, actually, just it's here. I can't stop it. It's already here.
Mm.
But I am resisting it, and that's making it more painful.
Yeah.
So what I'm going to do is flip into interest curiosity
Mm.
and go into that a little more deeply and say, what's it like
Mm.
when you're resisting
Okay.
the distress?
Yeah.
And it's like, gosh, it feels awful. It feels completely contracted. In
Yeah.
fact, here's one of the things I found in playing with this is I realized when I was resisting it and I flipped over into this interest, what's it like? I mean, like literally, what does
Yeah.
it feel like in your body when
Yeah.
you're resisting? And it's like, oh my God, I'm breathing again. When I went
Oh,
into interest,
interesting.
it tends
Yeah.
to be a little more expansive. And I didn't
Okay.
even realize when I was
Yeah.
caught up in the deprivation curiosity, the
Right.
resistance in trying to get rid of it, I
Yeah.
literally was not breathing or it was sure why shallow
Wow.
breathing. And it's like,
Wow.
oh my gosh, oh,
Wow.
I'm breathing a little more deeply here. Not that it's still fun
Yeah.
and that I'm enjoying
Yeah.
it,
Right.
you know,
Right.
but for goodness sakes,
Yeah.
the
Just meeting
difference.
yourself where
So
you
do you
are.
kind of see where when you go over
Yes.
here,
Yeah.
your situation has not changed,
Right.
and yet you're not suffering as much.
Okay. So it's
You
not
have
like you're saying, I'm okay with this. You're saying, I'm going to put more attention on how I'm feeling rather than trying to fix that external stuff by questioning it, I'm going to put that curiosity inwardly and say, what is that feeling like? What is happening inside?
Yes.
Yeah.
Yes. And then again, I guess the last strategic piece of it is um, just knowing that it's part of the human condition. We live with uncertainty.
Yeah.
And how can we get better at it's not going away,
Yeah.
but we can get more skillful
Yeah.
and more peaceful with how to deal with it.
Okay. So it can still be there, but we can develop those internal skills to be with it without fighting it every minute of the day.
Yes.
Yeah. So that's what
Or
you mean by
again, if you look at,
strategic.
okay,
Yeah.
so that part of your brain
Hmm.
that its function is to compare relative reward,
Okay.
and it will automatically pick the option that feels better because
Okay.
that's how our brain is wired.
Yeah.
So if you think about it this way, if I go
Right.
over here
Yeah.
and I'm caught up in the resistance,
Right.
my brain can compare that,
Yeah.
okay, that's how that feels.
Yeah.
Here's how this feels.
Yeah.
You're automatically going to gravitate here, especially
Okay.
if you keep reinforcing it, keep offering it so that your brain
Yeah.
literally starts to realize, oh, well, here's another option.
Yeah.
Huh.
Yeah. And that really takes that skill of mindfulness of being present in your body so you know how it feels. Otherwise, I find it can feel good for my brain to work on problems. It feels like I'm getting somewhere. Like I could solve this problem. Even if it's somebody else, I could fix that. And it's not going to work no matter, but it feels in my brain, it kind of feels good to work on those problems. Meanwhile, my body is in a total stress response. So it sounds like what you're saying is this strategic piece of this really takes that full awareness of our body too, to say, oh, wait, I might feel like I'm making progress trying to figure this out with my brain, but meanwhile, it doesn't feel good. What does it feel like if
Yeah.
I use interest curiosity and just get
Yeah.
curious about that? Yeah.
Yeah. And it's almost like when you stop resisting, it's not giving up.
Mm,
Okay. It's like accepting what is
yeah.
and working for change.
Yeah. Okay. So accepting doesn't mean it's okay. It means you're accepting that it's already there.
Yes.
Yeah.
It's not giving up
Mm-hmm.
and just resigning yourself.
Okay.
It
Yeah.
is not that at all.
Yeah. Okay. So you're just kind of working with what you have, and you have this strategic from your brain, these strategies that you're curating, these strategies of staying calm and opening up and relaxing, and then these physical strategies of embodying comfort.
And here's what to me is the greatest part about it. It is paradoxical.
Yeah.
It's like, so you're not resisting it so much,
Yeah.
you know, and then if you go over here and work with it this way, one way or the other, you are going to end up solving the problem.
Mm,
You do take it down. Do you know
yeah.
what I'm saying?
Yes. You have more
It's like
access to.
yeah, at least you're reducing it, and
Mm-hmm.
you're probably putting yourself in some kind of mindset to where you can come up with a solution
Okay.
now.
Yeah. Because
You
part of the
know,
problem is how the distress that you have from it.
yeah.
Yeah. Yeah.
Yeah, so
Wow,
that's
Jan.
that's the best part of all is you're not trying
Yeah.
to shut it down or get rid of it, and yet
Yeah.
you'll find that you actually do.
Yeah. Okay.
You may not
I
in
love
that
this.
moment
Yeah.
forever, and it never comes back. But
Right.
again, your brain is like, okay, between the two options, this feels a whole lot better. We're
Mm.
headed this way
Okay.
more often.
I love it. Jan, this is so helpful to just have this simple, these strategies, these two strategies that you could start with either one, comforting your body or doing this kind of mental shifting into open curiosity. And um, this is so helpful when this, anytime we're just
Yeah.
caught up in emotions, strong emotions, any strong emotions. It's hard. It's hard because emotions are felt in our body. It's hard. So I
Yes.
like that you're giving us these strategies. That's so helpful. Thank you.
Yeah. And thank you for emphasizing that point right there that if you're trying to help yourself emotionally,
Yeah.
well, those sensations are registering in your body.
Yeah.
Doing something with your body is a almost a direct appeal
Yeah. Yeah.
to self-soothing,
Yeah.
uh, emotional regulation,
Yeah. We need
distress
that.
tolerance.
Yeah, we need that skill of using our body to calm our nervous system. And we have kind of lost that. I kind of feel like we have many ways to distract from our body or many ways to kind of beat our body up. And I think that we need more ways to build this toolbox for using our body to
Yeah,
calm the nervous system. Yeah,
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 yeah. No, this has been wonderful. I'm so glad
yeah.
we had a chance to talk about this
Me
today.
too. Thank you for being spontaneous and
Yeah.
jumping on my bandwagon this week.
Well, you come up with great topics,
Well,
Janet.
thank you. It's really just from my patients and clients and myself and the people I'm around and just taking that in and saying, okay, what do we need to be well now? And I think we need a little dose of Dr. Jan. we we need this. And it just seemed very kind of time. It just seemed like we needed to do it now. I couldn't put it off until the new year. We need to
Yeah,
be well now. This time of year, even if we're in grief, even if we're sad, it's an important time of year,
yeah.
and there
Even
are
if you're like
joys out
really
there.
pissed off.
Yeah, exactly. You could be pissed off and still feel joy, right? You can still go find some joy somewhere in something. There's many opportunities for joy. And even if it's a fleeting moment of driving
Yeah,
around watching Christmas lights or something, anything at all, um,
yeah,
you know?
yeah.
Yeah.
You're right though. The timing was right to do this
Mm,
now.
yeah. So thank you. I appreciate it.
Yes.
Awesome. I can't wait for the next one. We'll see what we come up
I
with.
can't either. I can't wait to be back.